Hi, I'm Virginia, and welcome to the Health Creators Podcast, where we talk about the impact and business of being a health creator. Here with me today is Deepak. Thank you so much for being here today.
Thank you, Virginia, for having me on the podcast channel and for inviting me this evening.
Thank you. And so let's get started. Who are you and what do you do?
Thank you. So, my name is Dr. Deepak Ravindran. I'm a NHS consultant. I've been a consultant for almost 14 years now, and I'm also honorary professor at the Teesside University in the United Kingdom. I live in Berkshire, which is about 30 minutes west of Heathrow. And as a pain consultant, which is what I sort of do within the NHS, I practice in the NHS and privately. So that is kind of my day role. But apart from that, I've also had the opportunity for the last now 2, 3 years to be actually a health influencer, a YouTuber, a kind of omni channel present. I've got a Facebook, Instagram, videos on that front there. I'm a published author and I kind of done it backwards around. We'll pick that up later during the podcast there. And along with it, I'm also the chief medical officer for a digital hybrid platform. That's a startup that's based in Cambridge. So I kind of have a few hats there. And in recent times, in probably August 2024, I've moved from secondary care in the NHS to actually working in primary care with GP practices because I think a lot of what we need to do and I need to do in my specialism is about public health, lifestyle medicine, and sort of pain medicine education. And that's kind of what I'm doing right now as my day and night job.
Brilliant. Thank you so much. So, what made you start creating health education videos?
Well, a big thing has to do with the book that I wrote. And as I was saying in my earlier question there, where I said I usually most health influencers or social media, usually they become quite famous on social media or they gain a big following. And then from there, they are able to sort of write a book reflecting their experiences. And then, of course, you had a group of people who have done a whole lot of research and they bring their research into the public sphere by talking about it through a book. For me, I was in that slight weird space wherein I had a very small following on X, just about 1,500 followers at one point, and I was really doing a lot of face to face talking and educating of GPs and healthcare professionals when I would do the talks. And then I would be doing one to one in the pain clinic, talking to patients and telling them the same information about the new ways of managing pain, lifestyle medicine approaches to managing and overcoming your pain, and making people aware of that. And I realized that a whole lot of this information could be probably put out through a book. And I got singularly lucky in getting actually a book deal through Penguin Random House through a million. And when the book came out in 2021, one of the advice that my editor gave me was that, well, actually, you know what? You need to be talking about your book through social media. You need to be sort of stopping the imposter syndrome and getting out this message through multiple channels. And it's somewhere at that time I was doing my management degree and I had this sort of module on marketing, which actually talked about the fact that if you want behavior change and if you want people to think about your ideas, then reading is just one of the ways that adult learners learn. Many of them are visual, many of them are audio. And the general trend, which I got from some, I think, Google or some Coke, some marketing strategy they had, they said you actually need to be getting people on an average 7 to 11 touch points where they encounter your message through different mediums in order for them to sort of absorb your content and decide to change or even contemplate making a change in their habits or lifestyles. And I think that information combined with what my editor told me when my book came out in 2021 was what prompted me to say, well, you know what, I do need to enter making this information available to the general public in a wider sense through multiple channels. And I think that's how I started sort of doing Facebook and Instagram. And initially, I took a class on YouTube And that's when I started sort of bringing out content via these platforms, along with making X, Twitter, a little bit more regular. Otherwise, prior to that, I was a little bit inconsistent. But that is where I started my whole process of making videos. I had a book that already gave me the source of content, but that was where I started with my videos.
Yeah, that's brilliant. I love how the book came first and then the videos kind of came second, but then all of the content you needed was in the book anyway. So you just had to basically repurpose your book into videos, which is great. And so, do you find that making videos helps you in your practice in the clinic? So, does it help you to tell people the same information, but in like a visual way or in a more time efficient way? What's been your kind of experience with creating the videos and your practice in clinic?
So it's been an intentional strategy in terms of making videos. I wanted to learn the process myself, so I actually took a sort of YouTube course there. And here I'm going to give probably a shout out to Ali Abdal, and it was his sort of YouTuber Academy course that I did there, and I got the courage and everything to sort of make a couple of videos and do it. But I rapidly realized that I'm a busy sort of full time NHS consultant. I had a private practice in addition to my NHS practice, two young children, a wife who's working as well. I really found that within a short period of time, one, I neither had the true skills to do a proper job of editing, and two, I was not having enough time to actually do a good job of what I felt was good enough for me. And so I think within a very short period of time, within a couple of months itself, I realized that I'm not cut out for the game of sort of making the video and then doing the editing and doing the whole, thumbnail from front to back there. So I knew the process, I knew the pathway, but I decided I'd focus on where I was good at, and I would take the deliberate intentional strategy of getting a videographer and outsourcing that part from the very beginning. So I probably just did a couple of videos before I got myself a professional videographer with whom I had the arrangement with sort of dynamic creations, or dynamic comms is the name, with Rob. And he has been with me for the last 3 years. And what we then have, this is the strategy wherein every month I ideate, I decide on the topics along with Rob. We have this option of making the videos out there, and the ideas come from my clinic interactions and my consultations, some of the thoughts that come from my nurses or myself when I'm seeing patients. Oh, I wish I could say or signpost something, and that would be the idea that I would then develop and make into a video. And over time, what has happened now is that I get this mix. I get patients in the clinic to whom I can say, well, I've talked about this. While I've told you about this for 5 minutes in the clinic, I know I've given you a whole lot of information. But if you go to my channel, I talk about this a little bit more, and you can listen to the same topic. Go to this video and check it out. On the flip side, I've also had patients come to me both on the NHS and private saying, I saw you on that video there. I really liked what you said. It resonated with me because that's what I've been feeling like, and nobody explained it better and that you did. So I think you might understand what's going on with me, and I've come for help. So I've had a bit of impact in terms of people coming to see me based on my content. But at the same time, I've also been able to use my content to reinforce the message, because I think that's what I've another realized. In a 30-35 minute consultation, people hear a lot of information from us as healthcare professionals, and we know that what they retain is a lot less than what they are able to take away. So sometimes the content and the amount of content there, it's better to reinforce it. And I've done either a video or an audio about it, and I signpost to one of that, and that's where I ask them to pick it up. So that's how my content has come in useful.
Brilliant. That's really amazing. And I think it's a new way to practice now, because you actually have the ability to create these resources, and hiring a
Absolutely.
yeah, and hiring a videographer was a really smart move in the beginning, because it meant that you could focus on doing what you do best, which is to deliver the information, and then somebody else can make you look good on camera and edit the video and upload it and all of those kinds of things. So that was really smart move from the very beginning. So what is your, sorry, go ahead if you want to say
No,
something
no,
more.
I must say, while I was doing the YouTuber course there, I do realize that a lot of our clinician YouTube content creators, they may not necessarily be in the space. And I completely recognize what Ali would call a sort of the unfair advantage. I am a consultant and I had a private practice. So I did have something that I could deliberately say, okay, I'm going to use some part of my private practice income towards marketing, towards videographing, and that is going to be a payment that I'm going to do. And I know that that's not really what every YouTube creator may not have, but I think that's something we all recognize, is that as our channel grows, or as we are able to have getting or outsourcing that part which we are not ever going to be very good at, is going to be a useful strategy, because it does give me the time to actually focus on what I'm good at and what gives most value, I think, to my listeners and my viewers. And so I just wanted to highlight that I think there is a necessary growing journey that every clinician creator might have to go through. And sometimes I think that's a great advantage, having the ability to know how to edit, to know how to do the things there, because you can maybe tweak a video quickly or do something there. And I do feel sometimes that now I'm so hesitant, because the quality of my videos are really good being done by a professional. I can't spoil it by bringing out an amateur one from myself.
That's really interesting that you say that. But I would say, it's your platform at the end of the day, so it might be worth experimenting with that kind of video if you did just have a thought and you wanted to put something out there. But I'd imagine that you have a process to create health videos. So what is your process to creating videos, and why are you so hesitant to veer away from that process?
Um, so right now it is with Rob now, who we've got a very nice. He understands the way I work, what I think about. He's actually come to the point over the last 3 years. He sort of looks at the comments sometimes that my listeners have given along with me, and he'll actually say, you know what, there's been a huge engagement on this video there, but these comments that have come through, I think they need to be elaborated further. So one source of my ideas for my videos come from listeners' comments, viewers' comments themselves, because that itself is more listenership, more attention to what my listeners and viewers want to know about. The second place I get ideas from is when I'm doing the clinic, literally, and a patient asks me this question and says, I need to know about this. And I explain it to them, and they say, oh, that's nice. Thank you for making that so easy to understand. And I realize, well, actually, yes, you know what? That becomes my next video idea, and I can just bring it in. And so that forms one source of videos. Often my juniors or my nurses or somebody, when I have trainees in the clinic room, and they'll say, well, Dr. Deepak, why did you do this? Or, what's your understanding of this? Why should we learn about this now? That can sometimes become a third source of video creation there. I am looking at sort of other videos that are done by others, and I've been thinking of book chapters or book reviews that could be a source of video options there, because there's a lot of outside reading that I do. I'm a big fan of reading, and I probably reckon over the last 3 years since my management training, I've spent upwards of £10,000 just gathering a huge library of books, reading extra outside of this Blinkist. So sometimes I feel, oh, maybe I think book reviews should be another source of video ideas there, but that I've not developed on that. That's going to be my next choice there. But these are, so once I've identified the process, I go through almost that sort of design thinking process. I sort of develop the idea. I don't have a script per se. I initially tried having a very written or a written out script that I can say, and I found that I could not really stick to a script. So what I now have is a broad set of 4 or 5 points that I want to cover. Within those 4 or 5 points, I try to chunk it. So I have at least three sub points under each point. And so, therefore, in my head, I have already known what the big 4 points are, and then the three sub points under it. And so that's how my whole video flows. And the aim is to get somewhere between 4 to 8 minute videos. I wanted to do longer ones, but with the way I planned right now and the topics that I have, I'm trying to stick between the 4 to 8 minute mark as my video length. So that is what I sort of prepare for. And what Rob does is we both have an arrangement. So once a month, we have a catch up and I do a batched process. So I do all the videos, the shorts, and all of them in one go. And then over time, initially, we used to have an arrangement where once the videos are done, I kind of have a look at them and say, okay, which one needs to go out when. But now Rob and me have that understanding wherein he's got instant, so yes, 3 times a week, and it's omni-channel. So what goes out on Facebook, on Instagram, and YouTube, with the Facebook and Instagram shorts leading on to the YouTube videos. So that's kind of the process that I have right now. And LinkedIn, of course, as well, where all of these land upon there. This allows me the freedom that apart from these things that are going out regularly, when I suddenly feel like it, I could make a post on LinkedIn or add an extra post on Facebook or Instagram if I felt like it. But that's where, as I told you, I feel a bit of not imposter syndrome. I kind of feel, oh my God, if I make a video and the quality isn't great, it might come out. I don't think it should matter. As you rightly said, it's my channel. But I think that's where I feel a little bit hesitant still. So
Mm.
that's my process overall. And it's been refined now where me and Rob are like a house on fire.
Brilliant. Fantastic. So that seems like you've really taken the time to kind of streamline your process, and you're still investing in your knowledge, which is equally fantastic, because I think we do take for granted that information does go out of date, and so it's your responsibility to kind of keep that knowledge up to date, especially with health information.
Yeah.
So did you want to make an extra point on that, or?
No, no, not really. You're absolutely right among the accuracy of health information. And for example, in the specialty that I'm in, which is pain science, there is so much change. There is so much complexity, and everything that we have been taught in mainstream healthcare schools, whether it's a medical school or nursing school or pharmacy school or physio school, the knowledge about pain is completely outdated. What's coming through in the last 5, 10 years from a variety of researchers is not something that's made it into mainstream textbooks. And the maximum knowledge dissemination is coming from social media channels, is coming from researchers who have taken to social media to talk about it. So I think it really becomes my responsibility to stay abreast of the information and update my priors so that the information I give to my viewers is as current as possible.
Yeah, I think that's such a great way to think about it, because even in the education system, what you're learning at university or even as a consultant with, the new research coming in, that's probably not going to trickle down for years and years. And by that point, it will be out of date. So, for something to become common knowledge, it takes years of passing down through the generations. And I think we have a way to kind of buck that trend now, so we can actually get people that information sooner rather than later. And so what are your kind of top tips for health creators who want to get started?
I think the biggest thing is just get started. I think overthinking it is, I completely agree with everyone who I've heard say it. I think overthinking it is the biggest stumbling block. The imposter syndrome, I think, is the biggest stumbling block. So my advice has been actually to uh, in some ways go through the design thinking process. So I think if a health creator wants to get the information, and here I'm making the assumption that someone who wants to be a health creator is a clinician who's identified a pain point, something they're passionate about, something that they feel there is value in talking about this at large to the society on a topic that they have really educated themselves on and feel confident about, then I think almost all of that becomes important. So, for example, in the design thinking process, the first thing is to be empathetic and to know what your needs of the patients are. And that itself is a valuable source and a fertile ground for all the ideas to stem from. So, for a health creator, my top tip would be to say, yes, you have your equipment, whatever it is, start. But the main thing is to just get started and then iterate and improve as it goes along. I would really say think strategic about what you want and where you want to be. And I find that if you want your message and you're dealing with adults, then you do need to ensure that you're looking at multiple ways of getting that information out. So from the outset, think very clearly on how soon can you get some help to outsource the tougher technical bits so that you can focus on what matters in terms of getting the quality of the content and keeping that high. And I think those would be my sort of top few tips to ensure that you get started with the channel and with the content that you need.
Yeah, brilliant, brilliant advice. I also noticed on your videos that sometimes you don't dress in the same way that a typical doctor would. So, is that a kind of style choice that you've made on purpose? And what has the kind of feedback been from your audience about that?
Well, to be absolutely honest, there sometimes my dress choices have been criticized by my close friends saying, there, your tummy is showing. Why would you wear the t shirt today where your tummy is showing? You need to lose weight, man. You're not living the life of a lifestyle medicine friendly physician. So, yes, so I absolutely agree that I think it's a deliberate strategy for me to be as informal as I can, try to be a little bit more comfortable. I think in the UK, unlike US physicians, we don't really need to have the white coat thing to actually have the credibility factor there. But I feel that I'd like to be a bit more informal, find a little bit more different settings. Right now, most of the time, it's my home that I use as a setting, usually my kitchen area there, which has got a nice bit of greenery in the background there. But yes, I've been sort of experimenting with shirts and t-shirts really. I'd like to be a little bit more bolder, but I haven't worked up my courage as yet.
That's really interesting.
I'd like to do sort of, walking in the garden, doing some kind of, walking and shooting videos there, just sort of getting that comfort factor there, like I've seen other YouTube creators do it. But that's my sort of probably my 2025 strategy now.
Interesting. You might need to get Rob a gimbal so that he can put his camera on it and follow you
So
around.
he's got all the stuff that is
Oh,
required. So yeah, he's got everything that is required there. The problem is me.
okay. You mean the learning curve is you, the learning curve.
Yes, I'm on the learning curve. Yeah, the hills are steep, but I'll get there. Yes.
Great. So then how do you kind of fit around creating content with all of the other duties that you have as, as a full-time doctor? So you mentioned that you kind of batch produce your videos. So do you just have one weekend per month where you have all the ideas, then you write your bullet points and then you film and then everything's left with Rob to kind of disseminate everything? What's your kind of strategy to fit it in your life?
Luckily, I think probably one of the tips I would encourage all content creators to have is to see if you can maybe do a course, either in course or something informal on communication skills and chunking. So essentially, the way of trying to talk, hopefully without the need for PowerPoints or holding something in your hand, and the ability to use chunking as a way of getting the points out in a streamlined fashion without needing to use too many filler words.
Mm-hmm.
Once you've done that bit there, it becomes quite easy. It takes a little bit of practice, but once you reach that within a few months, I've often been lucky to do a lot of my videos with the first take. So I've not needed to do too many retakes and repeats now. And that has really helped because what it does mean is I have to now give only about half a day or a day where me and Rob have an arrangement once a month. And in the run up to that, I have a few ideas for which I write the bullet points. Rob sends me a list of from the comments on some of the videos which he thinks will be quite useful. And I then prepare on that in advance for the half a day that he's coming. and we just run through it, this many shorts, this many short form videos, and a couple of long form videos. And then he's able to take it away, edit it, do the front and the end. I've done the intros and outros before and the thumbnails. So then he's able to do his magic, and then he has the sequence of when it goes out. I've left that bit to him unless and until it's like September, which is a pain awareness month, or I feel there's a particular event or something that I'd like to tag a video to. I generally have the understanding that he can choose the order in which the videos can go out.
Brilliant. That's great. So, do you have anything else that you want to add, or are you happy to wrap up?
No, actually, this has been really wonderful talking about the process. It's been something that I've not had the opportunity to do. So, thank you really for having me once again. And if it is really helpful to health creators, then that's something I'm happy to support and advise. I think as a clinician content creator, I'm the only probably consultant YouTuber in my secondary care organization and probably in Berkshire at that point. So, I think we clinician content creators are still sort of a small bunch who are probably growing. So I think we all need the support we can. And I found the support from some of the events that YouTube organizes. You've been doing really helpful, the WhatsApp group. So I think this kind of forum is something that I think all creators will benefit from hugely. I certainly have benefited from being a fly on the wall and coming to the events and taking some ideas away from it to implement in there. So I think thank you for having me. And if I can pay it forward and supporting somebody, then that's fantastic. And otherwise, like all other creators there, I'm found on social media. So hopefully that will be something that there. And yes, from my own specialty, well, I love pain science. I love pain science education. I'm a neuroscience geek. I'm trauma informed. So if any of those specialty subjects interest your viewers and your audience, then feel even more free to reach out to me, and a couple of beers or maybe a whiskey, and you can have a good evening out.
Yeah, fantastic. Thank you so much. So, Deepak is available to reach out. So, do reach out to him if you want to have a conversation, if you want to get into it as well. And I'll leave all of the links to all of his content in the description box below so you can check it out. Thank you so much for watching or listening, and we'll see you at the next episode.
Thank you, guys. Bye.